With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
Good afternoon, everyone. I want to thank you for being here, those of you in the media, and certainly those who are up here with me. We just finished the UCG meeting next door, and I want to express my appreciation to everyone, because you wouldn't be here if you didn't allow your temperature to be taken. And we're certainly doing everything that we are asking the public to do as we work feverishly, pun intended, to contain the spread of COVID-19. As I just mentioned, we just completed a unified command group meeting on the state's ongoing response. You should know that as of now, the number of presumptive positive cases in Louisiana is at 67. The latest numbers came in just as we were finishing our meeting, and we're still getting information on the parishes where those cases are located. That information will be updated on the LDH website by 5:30 this afternoon. I can tell you that we have received our first two positive confirmations from the CDC of cases that we had presumed positive to begin with. But I really don't want anyone to attach a lot of significance to that, because we have practically 100% confidence that when someone is presumptively positive from a test, that they are in fact positive. We're seeing the numbers rise rapidly, which is what we anticipated would happen, and that is why we took the measures that we did yesterday and really starting several days ago. We know that we have a relatively high number of cases based on our population. The latest reports, for example, out of Texas showed that they were reporting 39 cases, and they have 6 times our population. So the biggest concern that I have is that it appears that if you look at cases per capita, we're number 3 or number 4 in the country, something in that neighborhood. And certainly our ability to deliver services, particularly medical services, will be overwhelmed with a lower number of cases than would be required to have a similar impact on services in other states. As public leaders, therefore, it's our responsibility to do the very best that we can always to protect the health and safety of our citizens. And that is why we are following CDC guidelines limiting crowd size to no more than 250 at any one time. And we are continuing to ask individuals who are older, and, you know, I'm just going to tell you what I've been told on this, is the first age at which we start seeing more serious complications related to exposure is the age 60. And then when you get to 70, it's even more pronounced, and 80 is obvious, and above, it's even more pronounced. So if you're an older citizen, or if you're a citizen with an underlying chronic health condition, you really need to be limiting your interaction with other individuals and in crowds at this time. To be clear, however, at no time did my proclamation cancel any church services. And I very much appreciate our faith leaders who understand and are working with us in this effort. I am a person of faith. I happen to believe very much in the awesome power of prayer. I also believe in science. And the scientists at the CDC say that the measures we are taking will minimize the spread. These are mitigation precautions that are essential, because what we have to do as a state now is minimize transmission and spread that peak demand out over a longer duration. Otherwise, we run the risk of overwhelming our ability to deliver proper health care. In addition to my own proclamation, 2 very important things happened in Washington yesterday. The first is the nationwide emergency declaration signed by the president, which we very much appreciate. And the second is the Family First Response Bill, which passed the U.S. House of Representatives. We also appreciate that. We will be looking at both of those instruments to identify any and all federal aid that we can take advantage of in Louisiana, whatever opportunities, whatever flexibility, whatever funding, we're going to be doing our very best to identify those benefits and apply for them and make them available just as soon as possible. I'd also want to make you aware of relief efforts being put in place by the Baton Rouge Area Foundation here in Baton Rouge. BRAF has started a charitable fund to make grants to Louisiana nonprofits that are expected to provide relief during the coronavirus pandemic. The funds will be used for feeding and caring for older citizens who can't leave their homes during the outbreak or who are quarantined. The fund can also be used for unexpected needs which may arise while we respond to this health emergency. To make a donation, and I encourage people to do so and be generous, not only to this but to all of our relief aids, but to make a donation to BRAF's Emergency Relief Fund, please visit braf.org, braf.org, and click on the link at the top of the page. And finally, I want to impart information that I do at every opportunity. It is essential that we minimize the spread of coronavirus. Every single person in our state has a role to play. And the degree to which we are going to be successful is going to be determined by the percentage of people, the number of people are out there who comply with these precautions. So I'm asking, please wash your hands frequently and for at least 20 seconds with soap and water. Cover your cough or sneeze with your arm. Avoid touching your face. Routinely clean and disinfect frequently touched surfaces. Avoid close contact with others. Practice social distancing as best you can. And stay home if you are sick. Stay home if you are sick. And I want to make a point about this and why it's so critically important. The test results that we're getting in today for the positive cases, those individuals probably received or were transmitted to the virus 4, 5, 6 days ago. So think about that. Even if from this moment forward not a single case gets transmitted, our numbers in all likelihood are going to continue to go up as people become symptomatic from the transmissions that have already happened. And so if you are feeling ill, stay home. There is a chance that you have the coronavirus and that social contact with others, being in close proximity to others, will unnecessarily expose them to the risk of spreading the coronavirus, even if your symptoms are relatively mild. Every citizen has a role to play, and I'm asking you to do that. You know, Louisianans have always been at our very best when there are challenges out there. This is one of those challenges. It is time to be good neighbors. It is time to think of our brothers and sisters, especially those in those categories who are most vulnerable, the elderly, and those with underlying health conditions. If you have any questions regarding the COVID-19 virus, we encourage everyone to call 211 for more information. Again, that's 211 for more information on the coronavirus. The next scheduled press briefing will likely be Monday. Obviously, if the circumstances warrant and we have updates to share between now and then, we will certainly do so. And at this time, I will take questions. Yes, sir.
Our temperature was checked before we came into the building. Do you encourage other places and people to do that?
Yes, I do. And so, you know, we have essential leaders coming in from around the state and local, as you can see on the stage with me, into this building. And one of the things that we want to do is make sure that people coming in here are not potentially spreading the coronavirus or potentially other illnesses as well. And so we are temperature checking individuals. And if you have a fever that's unaccompanied by a cough or other flu-like symptoms, then you don't need to do anything other than go home. And fever is anything 100.4 or more for this purpose. If, however, you have fever plus cough, other flu-like symptoms, then you need to take a flu test. If you take the flu test under that circumstance and you are negative, then you need to take a COVID-19, a coronavirus test. And so that's what we've implemented here. I think you're going to see something similar at the state capitol, and we have some legislators here where they're going to be doing that as well. Yes, sir.
Governor, can you tell us how many cases are at the Lambeth House in New Orleans so far?
9.
Still 9?
9.
Can you update?
Well, with a caveat, we don't. I don't know that we have all of the information with the batch that just came in, but subject to an update, we have 9 cases at the Lambeth House.
Were any of those cases in East Baton Rouge Parish or surrounding?
Not to my knowledge, but there's not perfect information on a few of those positive cases related to parish of residency. We will be updating that just as soon as we possibly can. Yes, sir.
Your proclamation sort of left it up to school districts if they're going to provide free lunches for students still, if they're able to. Is there anything the state is doing to help local school districts who might not have the ability to do that, and also to provide distance learning, online learning?
Well, all the school districts have the ability to do it because they have lunchrooms. The waivers from the USDA have been granted. And, for example, I will tell you what I know they're doing in Caddo Parish. They have identified a number of schools, and I think it's 12, I'm not certain, where during meal times you're going to be able to drive through with the students and pick up meals to go. So they will be bagged breakfast and lunch and so forth. I guess it's technically true that my proclamation left it up to them, but I think the word is that they shall do it to the extent that they can. And I think that making this nutrition available to our kids is extremely important. And so this is something that the Department of Education, under the leadership of Beth Ciano right now, is working with all the districts. And it is my expectation, quite frankly, that this will be provided in every school district. I can't tell you that will be the reality come Monday, but that's what we're anticipating. Yes, sir.
The president was talking about drive-through testing sites.
Yeah.
Are you guys considering that at all?
Yes, in fact, we are in communication with FEMA and the Health and Human Services in Washington, D.C. It's at the early stages, but we have been offered an opportunity to create at least one of those drive-through test sites in the New Orleans area. I don't have any information right now as to exactly what that's going to look like when it will be set up, but we are working with them. We're certainly not going to turn down an opportunity like that. As soon as we have more information, we will put that out and make it public.
Could you talk about test kits? Do we have enough? There's more coming in? Or?
Well, I'm going to let Dr. Bu, who is here. He is in charge of our testing. He's got that information available right now, and I will tell you that for the persons under investigation that we are testing, the testing capacity that we have is sufficient, and we also have commercial testing that is coming online. We are conducting testing at the public lab, the state public lab here in Baton Rouge 3 times a day. And we're providing the courier services to move samples in order to keep up with that pace of testing. And we're going to see over time more commercial testing come online. We know, for example, that we have healthcare providers that are using LabCorp and other private labs in order to test for the coronavirus as well. And we're going to make sure that as the information comes in from those private testing companies, that it is merged with what we're doing here as a state, so that when we give you information and when you go to the website of LDH, it's going to have all of that in the running totals. So that's what we're working on now, but I'll ask Dr. Bu to come up and respond specifically to your question.
Thank you, Governor. I agree with everything the Governor just said, and I think the point to emphasize is to meet the capacity that we want to at the state level to get those tests to everybody who has symptoms and is flu negative. As the governor said earlier, we really do need to partner with the commercial sector. You heard that yesterday from the president as well. And so we're looking to see those capacities increase. Currently, we are in a good position at the state lab. We'll note that, it's not just the test kits. There's all sorts of things that go into testing, including the ways that we take samples. And then we're trying to look upstream at all of those things, making sure that there's a path. But we also understand the entire nation is doing that as well. So we're going to be keeping an eye on that.
Could you tell us how many total people were tested?
So I believe currently we are at 178 persons under investigation. And again, the best source of that data, in case I'm wrong in what I just told you, is going to be on our LDH website, and that's updated regularly.
Now, there is some surveillance testing as well, and I don't know that your numbers include any private labs, or do they?
No, it's worth noting our numbers are going to be reporting what's in our state lab, but as the governor noted, we did amend the sanitary code a week ago such that all labs that are performed for COVID-19 in the state are reportable to us. So far, we know of 7 of those tests.
Governor, there's some overflow isolation areas being set up at state parks. Can you talk about why those are needed right now, who's going to staff them, how we decide who goes to these places?
Well, we need to make sure we have the capacity to take care of individuals who may test positive for coronavirus, but they're not so sick that they need to be hospitalized, but they may be homeless. And so we're just identifying areas where we could put these individuals so that their needs can be met in the safest possible manner, and that's what we're looking at there. It's a contingency for when we have individuals who are positive, don't need to be hospitalized, but don't have a place to go, and we need to be able to put them somewhere and have wraparound services, and that's what we're looking for at those locations.
Governor, we've shut
Yes,
down K through 12 schools and taken pretty drastic steps so far. Is there any indication of how much further we could go, what the next steps would look like, and whether that's under discussion right now?
Yeah, well, there's nothing else under discussion right now. There are not a whole lot of other things that can be done. There are a couple, and they get to be more drastic. You only have to look at New York, for example, that actually established a containment zone and is limiting movement in and out of that zone as a mitigation measure. So the additional measures are very restrictive, and we don't have a recommendation from CDC and to do those things yet, because the facts on the ground don't yet warrant them. But there are a couple of other things that can be done. Any other questions?
Governor, do you think the legislative session should be suspended?
We're working with the Speaker and the President and legislators on that, and they're taking some precautions, and I know right now the plan is to continue with the session to do its work. There are also some contingency planning that's in its early stages, and I appreciate their willingness to engage in joint efforts to develop those contingencies and make sure that if it does become necessary to suspend or discontinue the session, that the essential work is necessary. Obviously, come July 1st, we start a new fiscal year, and we need to have a budget in place, for example. So there are some legislative instruments that are must pass, and we're identifying those, and we're coming up with contingency plans right now. But the plan, as of right now, is to continue with the session. And if the situation warrants that approach be modified, then we will let you know at that time. And again, obviously, we're working with the Speaker and with the President on that.
So would it take like cases in Baton Rouge or at the state capitol to warrant that, or any idea what would
When we have facts that change, that warrant a change in that approach, we will let you know. Okay, I want to thank all of you for coming out today. And again, I'm going to ask the people of Louisiana, as I always do with any disaster, do everything you can to comply with the guidance that you're being given by me and by other authorities. And also, as I mentioned earlier in the different contexts, I like most of Louisiana believe in the power of prayer. And so I would ask that people pray for our country and for our state and for our people. God bless you and thank you.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.